Ulcerative colitis in adults 18 to 65 years, presented by Tracy Sonterre-rieger. This presentation is intended for the education of nursing students. At the end of this presentation, you should know what ulcerative colitis is, understand the symptoms, know both the modified and non-modified factors, understand the pathological changes regarding the disease process, nursing care interventions and treatment plans, cultural considerations, the use of technology, and a concept map has been provided at the end of this slide presentation for your review. Inflammatory bowel disease, also known as IBD, is a chronic disease that is characterized by inflammation in the GI tract. It can affect up to 1.4 million people in the United States every year. Now, there are two major types of IBD, Crohn's disease and ulcerative colitis. Now, while Crohn's can affect any part of the GI tract, ulcerative colitis is limited to the colon and the rectum. The word ulcerative is used because the disease usually causes the formations of sores or ulcers in the inner lining of the rectum and colon. The disease is characterized by periods of remissions and flare-ups. Thus, patients diagnosed with UC have severe impact of their quality of life, affecting both physical, emotional health, employment, and social opportunities. Symptoms usually develop over time, and these symptoms include abdominal pain, rectal urgency, anemia, weight loss, dehydration, fever, and bloody diarrhea. It's important the person become knowledgeable about what influences their symptoms in order to prevent relapses and deterioration of their condition. For example, knowing what can be eaten or what should be avoided may help prevent the worsening of symptoms. Diagnosis of the disease can happen at any age, but usually it occurs before the age of 30. Now that's important because a Netherlands study found that when the diagnosis of ulcerative colitis was in an older patient, that patient was at risk for more flare-ups during the first year, but actually had longer periods of remission compared to a younger patient. Now, ulcerative colitis affects men and women equally, but there's approximately 20% of those patients with ulcerative colitis have a family member with some form of IBD. The highest incidence is found in the Caucasian population, with individuals of a Jewish descent 3 to 6 times more likely to develop the disease. Now, in the past, it was considered a problem of industrial society, primarily due to westernized lifestyles associated to environmental factors. With that being said, increased incidences among African Americans, Asians, and Hispanics have been reported. It's been suggested that it's primarily due to developing countries becoming more industrialized, with such things including sanitation, occupation, diet, lifestyle habits, medication. For example, diets high in fatty acids found in red meats, margarines, and various cooking oils are associated with increased risk of developing ulcerative colitis. Also, there's a study that points out that sleep deprivation may also increase your risk, as the lack of sleep increases the production of inflammatory cytokines, which causes disruptions in the immune system. So let's take a moment to talk about normal bowel function. The colon is a major site of water absorption and electrolyte exchange in the body. Approximately 90% of the fluid contained in the ileum is absorbed in the colon, and that can be as much as 5,000 milliliters of fluid per day. The production of short-chain fatty acids provides an important source of energy for such processes as active sodium transport. There's also the production of both mucus and gas. And motility of the colon is best described as intermittent contractions that help move the contents of the colon both forward and backwards. And defecation involves this mass colonic movement. The lining of the intestine is exposed to a variety of food, antigens, and pathogens. Ulcerative colitis occurs when there is an active response to these elements causing an increased inflammation of the bowel lining. Studies suggest that ulcerative colitis patients demonstrate high levels of immune globulins, IgG, T helper 2s, and neutrophils in the mucosa plasma cells, which creates an increased intestinal permeability in these patients. The severity of the inflammation is based on the symptoms. And as the disease progresses, the inflammation causes the mucosa to be replaced by scar tissue. Ulcerative colitis patients are at higher risk for colon cancer, perforation, toxic megacolon. The illustration there kind of shows how the colon expands, creating abdominal distension. This is a common complication for these patients, and they should be seen in the hospital. Now, while the majority of the symptoms occur in the intestine, the disease can also cause problems in other parts of the body, including the eyes, joints, skin, kidneys, and liver. And that's why early detection is important in achieving and maintaining remission and promote the patient's quality of life. Between 15 and 20% of adults with IBD will also develop joint inflammation of the hands and feet. And as their symptoms increase with IBD, so does the severity of joint inflammation. Also, these patients are being diagnosed with osteoporosis related to the medications such as corticosteroid use. And that is why it's recommended by the American Gastroenterological Association, the AGA, to monitor vitamin D levels. Because as we know, vitamin D regulates both calcium homeostasis and the immune function. The human body works very hard to maintain fluid, electrolytes, and pH in order to prevent dehydration. Now, we know the major function of the colon is the reabsorption of about 90% of the water and electrolytes. Studies suggest that electrolyte deficiencies in ulcerative colitis patients may be life-threatening due to the decrease of sodium and chloride absorption, which then results in an impaired water absorption. That study went on to talk about how mucus samples were collected from these patients, and it showed that they had higher levels of sodium potassium in those cells in comparisons to general population. Calcium and magnesium were also found to be reduced. As a result, diagnoses of hypokalemia may occur because of limited calcium intestinal absorption and an imbalance of vitamin D. Many patients will present with cough, shortness of breath, or chest pains. The inflammation of the airway observed in IBD are most commonly involved in the bronchi. In such cases, about 39% of the cases were seen in non-smoking women. A common pulmonary manifestation seen in 66% of IBD patients was bronchiectasis. Studies suggest that IBD may be more related to asthma than previously anticipated. Studies suggest that about 40 to 60% of the patients with ulcerative colitis experience a reduction in the diffusion capacity of carbon monoxide. If left undiagnosed, the reversible narrowing of the airway will occur, resulting in tracheal stenosis. Also, the suggestion of drugs used in the treatment of ulcerative colitis also induce pulmonary issues. Many of these patients report difficulty with body image, sexual dysfunction, and overall sexuality. Up to 75% of women and up to 44% of men have reported sexual dysfunction at some point. These people were all of childbearing years, and the factors around the dysfunction turned out to be more related to depression than the actual disease process. Because studies do show that most IBD patients have normal fertility. There is a subgroup, though, that seem to have issues with fertility, and those are those with nutritional deficiencies, having various surgeries or other disease processes, or a conscious decision just to be childless. And there's one theory out there that talks about an autoimmune connection with diseases. This study was of Danish women with endometriosis who found that they had a 50% increased risk of developing inflammatory bowel disease in comparisons to the general public. Anemia is very common to these patients due to severe bleeding and iron deficiencies. But other manifestations associated with ulcerative colitis include leukemia and myelodysplastic syndrome, MDS. You may have heard of it. Robin Roberts from Good Morning America was diagnosed with it, and it's a cancer in which the bone marrow does not make enough healthy blood cells, and there's abnormal blast cells in bone marrow. And it's believed that there's a connection between IBD and MDS due to the type of immunity dysfunction which impairs the T lymphocytes. The first line of treatment is with medication. Anti-inflammatory drugs really help treat the symptoms of the disease. They're relatively safe with very few side effects. Immune system suppressors do what their name entails. They suppress the immune system, so it's important to be monitored by healthcare professionals. But between 23 and 45% of these patients are going to need to undergo surgery when medication no longer is effective. And it is the only cure for ulcerative colitis. And so patients will either have a colostomy or an ileostomy, as illustrated in the slide as you see here. And so it's really important that as nurses that we monitor their vitals, especially the heart rate and respirations, using something like the modified early warning score so that we can ensure patient safety. The use of a stool chart helps to measure improvements in deterioration of a patient's condition. It can be used both at home and in the hospital, and it encourages patient participation. We also need to measure fluids to help prevent dehydration. Document foreign travel to help rule out infections, such as C. diff, as well as monitor glucose levels, as these patients are at higher risk for developing diabetes. Assess for psychosocial issues, as these patients may have anxiety, depression, or body image issues. And lastly, counsel on dietary changes. Many patients follow low residue diets, as well as the intake of probiotics. Living with a chronic disease such as ulcerative colitis really requires the person to have an ability to effectively cope with the stresses that come with the disease. And so I've included here the Crohn's and Colitis Foundation of America's website because they have local branches, information on their website, also for legislation and resources to really help give them the support they need. Also, many of our patients are living in facilities where they may have 4 beds to 1 bathroom. We need to make sure we're offering additional time and privacy to those patients. And lastly, they are at higher risk for colon cancer, and so it is recommended that they have colonoscopies every 1 to 2 years. I just would like to take a moment to talk about cultural considerations, especially when the progression of the disease reaches the point where surgery is the only option for treatment. Because we need to know how to talk to these patients in helping them make the decision that could affect their life. For example, considerations to the Muslim practice is important when discussing the placement of the stoma, as the output from the ileostomy is considered to be clean, comparable to the output of a colostomy is considered dirty. Patients are now able to use their smartphones and tablets to download the app called GI Monitor. And this was an app that was created by a patient with inflammatory bowel disease. And it's a great way to monitor your symptoms and also note various other information that you can share with your doctor in order to get the best medical treatment. I also noted on here once again the www.ccfa.org, the Crohn's and Colitis Foundation of America, because the World Wide Web is a great way to access information, research, and current legislation about the disease. This concludes our presentation.